Hello, isolation precautions. Sometimes patients have to be isolated to prevent or stop the spread of diseases. And the way they do it over here is a lot different from how we know it back home. Over here, the patient stays in rooms. Back home, patients stay in wards. So when we're isolating back home, the should I say equipment and space is kind of like a limitation for us back home. But over here, they go over and beyond to make sure that patients are isolated. So if you're transitioning your practice, when you come, you find that there are some patients that in some rooms, there is an isolation cart just by their room, and then there are some practices that are not, you may not be familiar with. So that's what this video is for. So basically, there are three of them, and that is contact precaution, droplet precaution, and airborne precaution. We know that there is something like standard precaution. So standard precaution is you do it all the time for all the patients. That's hand hygiene, waste disposal, injection safety, and then respiratory etiquette. That's proper coughing and all that. So all those are standard precautions. So but these other ones I'm talking about, they are specific for some kind of diseases. So you are supposed to do the standard precaution in addition to these ones. So let's go. The first one I mentioned is contact precaution. This is done for diseases that can be spread by direct or indirect contact. So for that one, we need the gloves, we need the gowns, we need to put a sign on the patient's door that this patient is on contact precaution. And then we need to use dedicated equipment for the patients. Diseases that that lead to contact precautions can be C. diff, norovirus, MRSA, RSV. This is not an exhaustive list, but at least these are the common ones you will see more often. Then 2 is droplet precaution. These are the diseases that are spread through large particles in the air. So you still need the gown, you need the gloves, you need a surgical mask, and then you need to put a sign on the patient's door, and also use dedicated equipment. If you cannot use dedicated equipment, you should disinfect the equipment with the appropriate disinfectant. That is that for droplet. Then the diseases that lead to that is flu, whooping cough, mumps. COVID can also fall into that. There are others, but these are the most common ones. Then airborne precaution. Airborne precaution is diseases that can spread through small particles in the air. So droplet is large particles. Airborne is small particles. Examples of those diseases are tuberculosis, measles, smallpox, SARS. In addition to this precaution that I just mentioned, that's airborne, the patients with such diseases are also placed in negative pressure rooms. These rooms have a lower pressure than outside of the room, which helps to contain the pathogens, as in to reduce their spread. So having said that, you still see different some other kinds of precautions, such as contact plus. Contact plus is like a higher level of contact, whereby the disease requires more rigorous cleaning, maybe because they are associated with spores. You know, spores are hard to destroy. So an example of that is C. diff. C. diff is an example of a disease that may warrant placing a patient on contact plus. Another time you may see them say on the sign, contact and droplets. This is very common for COVID because COVID can be spread through droplets as well as contact. So that's that is for COVID, contact slash droplets. Then another one you will see, which is not so common, is neutropenic precaution. That one is done for patients with low immune, whose immune systems are compromised, especially patients coming out of chemotherapy, patients that should not have any contact with anybody who is sick. They should not eat anything raw. They shouldn't put any plants in their rooms or flowers because their immune system is low. And then the sign, of course, should be on the door. Whoever is going in there should not be sick in any way because these people have low white blood cell count, so their immune system is compromised. So that about sums it up. Thanks for listening. Make sure to like, share, subscribe, and follow for more.